Good morning, everybody. Good morning, Dr. Ceja. Thank you for joining us um, from Tijuana. And I would like to say hi to everyone else attending our monthly webinar for weight loss surgery in Mexico. Um, we're just waiting a few more, maybe one more minute or two to make sure everyone is joining so we can get started. Just going over the raffle that we have for our monthly webinar. Basically, if you have not, prior to this webinar, have filled out a HQ, which is a health questionnaire in our MexicoBariatricCenter.com, please go ahead and do that. And if you have filled out the HQ before or you're already on the calendar, you don't need to do that. We just have you just have to know that this raffle is only for Dr. Jesus Ceja. And if you're filling out a new one, please select Dr. Ceja as a surgeon of your choice. And one of the requirements of the entering the $2,000 off of surgery packages is to be in attendance in the webinar to the end of the presentation. So again, fill out a health questionnaire if you haven't done so before, and uh, watch the webinar to the end. Okay, so yeah, it looks like we have pretty much most of the people attending join. So like I said, we always select the first Saturday of the month to do our online webinar for weight loss surgery in Mexico, unless there are some events like Super Bowl or things like that. But this month we didn't have anything like that. So today is the first Saturday of the month. Uh, one uh, point that I need to bring up here is to please make sure you watch the webinar carefully because we try to cover as much of the frequently asked questions during the presentation. So, and then of course at the end we will cover the ones that are not answered as much as we can. Usually we can cover all the FAQs at the end, but sometimes the questions are beyond the 2 hour limit and we pretty much let them call us or contact us to ask those questions. The topics that we're covering today is basically we see what is obesity and what is the risk of being obese, weight loss surgery as a definitive tool for curing this disease, and we talk about MBC, Mexico Bariatric Center, and Dr. Ceja at that time starts covering the different bariatric surgery options that are out there, all the laparoscopic, endoscopic, all the different options, talking about the specific vitamin for post-bariatric patients. And then we open up for Q&A session. And at the end, we do the $2,000 off of packages uh, raffle for a lucky winner. By the way, my name is Ron Ellie, and I am the CEO and founder of Mexico Bariatric Center. And as I mentioned at the beginning, I have a pleasure to have Dr. Jesus Ceja, our top surgeon in Mexico, joining us. And basically, we've been doing educational seminar and webinar for so many years. And after pandemic, pretty much we just stuck to online presentations. And we still like to go to places in the US and Canada if we get an opportunity. But for now, we're just doing the online every Saturday of the month. Uh, Basically, obesity is a complex disease, and it's more and more determined to be a metabolic disease. And it's basically growing as a pandemic all over the world, in US, all the countries. And pretty much, our bodies are not used to the high calorie food and sugary food, and not not used to being inactive as much as we are these days, especially in US. That in big cities, you just drive your car from home to work, and you just work and you go home and you crash, and you basically continue to do this routine every day. And we are bombarded with food, we are bombarded with sugary drinks, we're bombarded with ultra processed foods. And basically, in medical field, they came up with this one formula, which they call a body mass index, BMI for short. And you plug in your height and weight, and it gives you a number. Anything below BMI of 25 is considered healthy. And once you start going over 25, then you may be overweight and obese. And of course, after 30, the obesity becomes more severe as morbidly obese and super morbidly obese and super morbidly obese. And these are all BMIs of 50, 60, 70, 80. And one thing we need to mention here is about the expertise we have at NBC, that we are not limited in a certain BMI. We could do pretty much all BMI that is out there. We've done several of BMI of over 100 in our center. Again, obesity epidemic or pandemic is caused by increased nutrition content of that we are exposed to, lack of physical activity, comfort eating, stress eating. These are really huge, inadequate sleep, and the weight gaining drugs that we sometimes take on a regular basis for different conditions we have. Um, when we gain weight, we're not just adding fat tissues or what is called adipose tissues. Their structure is also altered. And that is basically what is causing all different problems that we face when we gain weight. One is being insensitive to insulin and insensitive to leptin, and not responding well to therapies and vaccination. Obesity is a major risk factor, as we know. And for example, in the US alone, over 40% of adults are facing this problem. And I like to always show this animation to show what happens when we gain weight. So let's watch that together. This is like one only illustration of what happens when we gain fat in the abdomen and what it does to our breathing and our lungs. Um, of course, it's not just that, it's beyond that. The cardiovascular problems that comes with it, stroke, diabetes type 2. Um, we always worry about our heart, but there are so many other organs that are affected by this, or kidney is huge, and it's like one of those organs that we don't pay attention to, but it can be, um, getting, you can get chronic disease, kidney disease, inflammation, like we talked about. um, During coronavirus COVID-19, we all find out what it means to have more fat cells and be overweight and obese. And the reason was because protein was a breeding ground for the coronavirus, and they were attached to those fat cells. The more fat cells, there were more attachments they could attach themselves to. And then you're going to ask, okay, so what are the available cures to get rid of this obesity? Of course, diet and exercise. This is classic. Um, you know, that we always need to be active and watch what we eat. But if you are BMI of 30, 40, 50, the longer we are being having that extra body fat, the harder it is to get rid of it. And then, of course, the magic pill, the pharmaceutical, that has been an attraction from so many years, that we want to find that magic pill that we take and we lose all the weight. You know, like recently, these injections that Ozempic, which was supposed to be a drug for diabetes type 2, but it did help with the weight loss as well. And that has become a magic drug. And you see so many TikToks and social media, um, advertisements for it or promotions for it. And you see so many celebrities are all on taking Ozempics and the medications like Wegovy and Monjaro. And that's another subject by itself. But again, at this time, bariatrics and weight loss surgery procedures are the only proven, quick and safe and long term. When we say safe, of course, is relative. And that's the only long term solution that is out there. And we're going to see why. Um, when we go on diet and exercise, our body resists to it by lowering our metabolism and making us eat more because it's afraid that there's going to be a famine, there's going to be no food, and we don't get the satiety, so we have to keep eating. And basically, this is a kind of a technical explanation of the difference between diet and exercise and bariatric surgery. um, basically, when we get when we go through the bariatric surgery, our metabolic system is reset, and that's what happens when when you when you receive this procedure. Your body, your brain, and your hormones are start to operate at a different level. And as you see, like this person in my right side of my screen that weighs 250, at 250 pounds, the brain and gut hormones and all the hormones are interacting around that metabolic set point. Now, if this person, let's say, go on very strict diet and does boot camp type of exercise and loses 75 pounds, the brain still is thinking at the 250 level interaction of brain and gut hormones interaction. So the reason that the body resists is because the brain still wants to take you back to that 250. So again, it's going to lower your metabolism and increase your hunger. But the minute the surgery is done, your gut hormones, your all your hormones in your body is reset, and the interaction between the new hormones and the level and the brain operates at a different body thermostat, which is could be equivalent of 175 pounds. So what happens is the hunger goes down and metabolism goes up. So you lose fat fast and you keep it off for sustainable weight loss. And so the bariatric surgery is like a magic. Is naturally resetting your body's thermostat. And so these new set of drugs that what we call Ozempic and Wegovy and all those, we call them just as like a generic Ozempic. They're all trying to mimic and simulate the effect of bariatric surgery, like basically injecting GLP-1, which is a byproduct of the bariatric surgery, into your system. And again, he has his own, because it's a drug, it has its own side effect. You can't use it if you have problem with your thyroid. And again, you have to keep using this medication. And if you stop, you regain the weight back. Of course, every solution that is out there is effective, and its effectiveness, it depends on the person, it depends on their lifestyle, it depends on their genetics, it depends on so many factors. So let's say if you look at this pyramid, you see that maybe diet and exercise may work for maybe 3 to 5% of people in general. And then this comes the semaglutide injections like Ozempic that works for maybe 5 to 10%. And then we go to the endoscopic procedures like gastric balloon and ESG, which you call endo sleeve. Those are still, working for some people, not for everyone. And then bariatric surgery is the most definitive answer to lose weight and keep it off. And those are like gastric sleeve bypass, duodenal switch, and Dr. Ceja is going to cover all that in maybe a short time, maybe half hour or less. Um, so basically, where does MBC or Mexico Bariatric Center comes to picture? you say, okay, Ron, I know this is a great solution, but my insurance doesn't cover, or when they cover, it's very hard to qualify. And the out of pocket expenses is more than what you guys charge. So that's why medical tourism comes into picture. And that's where NBC comes into picture. We are a coordinating company that connects you with the top quality services, medical services abroad. And if you look at CDC guideline, it recommends you to go with a coordinating company that does all the pickup, all the travel, arrangements when you are in the, uh, foreign country. And they also have a track record that you can find and you can research and you can depend on. And third, and the last, not the least, is be able to buy medical tourism insurance. And that's what we provide. Medical tourism with MBC, Mexico Bariatric Center. We are a quality medical, we provide quality medical care with a VIP treatment. Um, when I was talking about researching the company, and we need to really be aware of the social media. Social media is great, but at the same time, it could be deceiving. You can post before and after photos, and you know you can buy followers on Instagram. You can do all these things to show that you are a valid company, but there is really nothing behind it. You can put up a nice website as well, but again, who is behind a nice website? Where are the credentials? Where is the review of patients? Are you, like NBC has over 600 Google reviews, maybe more, maybe 700, I don't know. But and you could go back to years and review. We're not just buying reviews to show that, hey, we're a 5-star company. So these are the factors you want to look into when you're selecting which company to go with. Basically, NBC is a U.S. corporation. Our main office is in Sacramento, California. We have, been around for years. Myself, I've been involved in medical tourism since 2007. And we started NBC in 2012. So with NBC, we are over 12 years. And you can see all the history of what we've been doing. And then you're going to ask, why NBC? There's so many reasons to choose us, so many reasons. And these are just highlight of the reasons that you may want to consider when you go with us. We are one of the top medical tourism operators around the world, not only Mexico. Um, our reviews from our patients, like I mentioned, on Facebook, on social media, on Google. We match the patient with the right procedure with the right surgeon. And you see how in a minute. Um, our packages are all inclusive. So most of the stuff you don't have to worry about. And, We put safety as a number one priority for our patients. We use the best and the most educated and certified surgeons, most experienced surgeons. Um, we are offering one of the most complete um, spectrum of bariatric surgeries in the world. Our scheduling is very simple. You know, one, two, three, you do HQ, you get approval, you go on the calendar, you pay the deposit, and then you make your trip, you do the paperwork, you're done. It's very simple. Um, we have been educating our patients, um, our future patients, past patients, through our webinars, seminars, all over the world, US, Canada. We have one of the lowest complication rates that you can find. And we'll touch base on that. The results that we're getting from our patients, how much they lose, how wonderful they feel. These are great results, not just, not every surgeon does the same gastric sleeve procedure. You need to go with the one that has the skill and the experience. You get the care and support from us after surgery. We're not a fly-by company, and we're always here when you need us. Um, we have a team of surgeons that we manage their load day to day. Again, we are a corporation in California. You can go on BBB and find out about us. And we are certified by Medical Tourism Association. Um, we help you with your time off from work, all the FMLA paperwork. We have one of the greatest nutritional program out there. We have a surgeon liaison on our staff that has, you will see how that affects your approval. And like I said, we have been with MBC over 12 years of experience with over 20,000 successful procedures. And we offer a highly discounted medical tourism complication coverage, which we call MTI insurance. We've always been a visionary in our field. And one of the uh, projects that we felt years ago that we need to add to the top quality services that we already providing was the hospital. And Hospital Azar was a project that we started officially in end of 2020, and it's been ongoing, and we almost finished. We're just basically waiting for a couple more documentations to start. And this facility is going to have over 35,000 square feet of useful facility with 4 operating rooms and 40 patients' rooms. And everything in this center is top of the line and the most advanced equipment medically that you can find. These are some pictures that you can peek through. Um, and let me make sure I can pass that. This is one of the pictures early on. This was during COVID, and Dr. Valenzuela was helping us with some of the design stuff. And this is one of the visits down there. And like I mentioned, we have 10 years with NBC in medical tourism in Mexico. We have performed over 20,000 successful surgeries, and we have the top six quality bariatric surgical teams in Mexico. Our packages are all inclusive. It covers the hotel, hospital, pre-op, post-op tests, hospital fee, nutrition support, private transportation, surgeon liaison, and medical tourism. Of course, MTI insurance is optional, but we highly recommend. It's a deal of the century for the price what you get. Um, our process is very simple. Step one, two, three. You fill out the health questionnaire. You you get matched with the best surgeons for the best type of surgery that you need. Of course, we will mention that when you are scheduled for a type of surgery, you still have a chance to talk to the surgeon before you go through the operation when you're down there. And then you pay the deposit, and I have good news for the deposit, and I will share with you for the deposit at the end. And basically, once you're on the calendar, you pay the deposit. Your slot is secured. Now you go ahead and arrange for your travel, whether you fly or drive down there. You you finish the paperwork, and you are on your way to be on the losing bench. So talking about support is huge to make sure that you stay with the program, because bariatric surgery is a great tool, but you still need to work to get the maximum and best out of it. um, our support group, we have several support groups, and the biggest one has over 10,000 patients. These are past patients. We have another group which we call Inside Facebook, and Inside NBC is basically for patients who are joining us. They're not, on the calendar yet, but they're getting there. And basically, you have real time support from our past patients, from our staff. Now, here's another reason to go with us. This is five of our past patients that they're so passionate about the bariatric surgery itself and what MBC has done for them. And this team is basically um, is like icing on the cake. Sarita, she's the one that is mostly involved in pre-op patients preparation. She works with the patients on Facebook. Um, Rena, great soul, she's one of our top coordinators, affiliates. And Dawn, there's not enough I can say about this team. Kelly and Jamie, and they're all just helping us day to day to support you guys. Um, this is a slide that she actually shared with us in one of our meetings, and we just posted here. This is, for example, Rena and what she has been able to achieve, and with the help of MEC. They also have a podcast, Rena and Sarita, that is very useful if you want to tune in. Basically, so let's talk about the travel. What's the travel look like? You basically fly or drive to San Diego International Airport, which is under construction. Terminal 2, it's basically, well, Terminal 1 is Southwest, and that's the one is going through renovation. And Terminal 2 is all the other airlines like Americans, United, Delta, Alaska. Those are all landing in Terminal 2. but terminal 1 is a mess. But still, you won't see the mess because all you do is you hear from the driver the day before your travel, and you have their number. They tell you to pick up your luggage. Again, please make sure you pack light, and don't bring a lot of stuff. Bring a simple, just one suitcase, not a big one, just a small suitcase. And then you basically pick it up. If you have checked it in, if you haven't, you just bring it with you, and you walk out. You look at the curb to see on the sidewalk what letter you are. You tell the driver, and they're right there to pick you up. We want you to arrive before noon if possible, and leave after 2 p.m. So arrival before noon and departure after 2 p.m. Now, what if you can't make these timings because there are limited flights or something that you can achieve? Some patients choose to come a day ahead of the pickup and stay in San Diego, or do the reverse, stay one night after the surgery in San Diego. And we have a deal with um, Hampton Inn in San Diego, near San Diego International Airport, and you can take advantage of that. And of course, they used to be a lower rate when back in the time when COVID hit, but now they keep raising it. But still is a great deal for just MBC patients. Okay, so for patients or for people who joined us later on, and I just want to make sure you guys have a HQ in our system, health questionnaire in our system. And it doesn't matter if you're not with Dr. Ceja, as long as Dr. Ceja can approve you and you can get the type of surgeries that he provides, you can qualify to be in the raffle. And of course, we want you to watch the presentation to the end, and that's a requirement. And at that time, we're going to do a $2,000 off of surgery raffle. Okay. Now, why MBC? Six team of surgeons that are the best in the world. So, Dr. Miguel Montalvo, Dr. Louisiana Valenzuela. Dr. Valenzuela has been with us since 2012. This is the type of experience and expertise you're getting. Dr. Alejandro Gutierrez, another FACS surgeon. Dr. Rodriguez Lopez, it's like a super surgeon. Dr. Jacqueline Usuna, she was doing bariatrics back in the time when bariatrics in Mexico was, not so much known to medical tourists. And Dr. Jesus Ceja, one of the best you can find in the industry. So we talked about the approval. And what is the surgeon liaison doing in MBC? Every patient that submits a health questionnaire basically gets reviewed by the surgeon. Is first of all, we want to do the best match for the type of patient, the type of surgery they're looking for. And then surgeon liaison is looking over all this traffic and double checking everything and making sure everything is matching to the teeth. Okay, so this is on top of the nutritionist, this is on top of the patient coordinator, which is your case manager. We'll have all this system, underlying system. This is what is like making sure everything is matching. Okay. um, our pre-op diet is basically a program that ensures you go through the surgery as easy as possible. And depends on your BMI. It could be anything from just a 2-day clear liquid until it could be, depends on BMI, could be few weeks. Make sure you do your pre-op diet as best as you can. It will be easier on you. It'll be easier on the surgeon. Um, and we talked about surgical center. We've been using Medioctor Hospital, but we are switching hopefully soon. And we've been using Hyatt. We had to go back for a while to Marriott, and we're back to Hyatt again. Um, our patients are happier now. Um, Medication, as far as medications, we will give you instructions. Of course, the surgeon will tell you when to stop and when to start the medications you are taking on a regular basis. But as a general, stop taking blood thinners, NSAIDs like Advil, and make sure you comply with the instructions that the surgeon liaison and the doctor tell you. One thing you want to do is, even if you're not supposed to take that medication, still bring the bottle of those medications with you to Mexico, just in case. Pre-op is very simple. You just show up. We pick you up from the San Diego airport. It's about 25 minutes to our facilities, but of course the traffic is huge. Factor, it's been really busy. The traffic in Tijuana, in the border, sometimes is busy. But anyway, we get you to our facilities. We do the pre-op test, which is EKG and blood tests, making sure the internist review your health history again, and we take you to the hotel. In hotel, they have jello, they have broth and ice chips, and you be relaxed, enjoy, just get a good night's sleep, and be ready the next day when they tell you to show up. Of course, your companion, if you have one, is going to stay with you the first night. And then once you leave, it will stay in the hotel where you're gone. It has a great free breakfast that is included in the hotel, and they can take advantage of that. On the day of the surgery, you show up at the time you are told in the lobby. They pick you up, they take you to the hospital, they prepare you for the operation. And once you're done with all this, they take you back to San Diego. And now you're ready to fly or drive back home. Okay, one of the many reasons to choose MBC is surgeons' load management. We basically manage every day how many surgeries each surgeon is doing based on the type of the complexity of the procedure, and we always giving him at least a day or two in the week off. They're not overloaded, or one day they do 8 and one day they do 1. It's always a uniform load for each surgeon. And that's one of the main reasons that our complication rates are less than 1%. Okay, so now we get to the part that I'm going to introduce Dr. Ceja. Of course, he doesn't need introduction. Our surgeons are so well known, but still, I like to talk about him. He's one of the highly regarded, educated, board certified surgeons for bariatrics in Mexico. And he's been doing specifically just bariatric surgery since 2017. Of course, he was a surgeon prior to that, but he dedicated his practice to bariatrics. And, he has done so many surgeries, and he's still so young and so careful with each surgery. And so now I'm going to let him talk about the procedures that we provide in the center and talk about himself a little bit and share why he wanted to become a bariatric surgeon. So there he goes. Dr. Ceja, please take over, and I can be quiet here.
Hi everyone, I'm Dr. Ceja, Jesus Ceja. We talk about a little more about the different procedures we offer here in Tijuana, Mexico. And this is the different options that we have for offer here. Next one, please. Obesity is a global public health problem with multiple causes. Treatment options include lifestyle changes, diet and exercises, medication, and bariatric surgeries. Prevention is key, promoting healthy lifestyles. Bariatric surgery is currently the most effective way to lose weight and improve diseases and related to obesity, such as diabetes or high blood pressure mainly. Next, please. We start with the most common bariatric surgery, gastric sleeve. In this type of surgery, we remove approximately 80% of your stomach using an average of 4 small incisions average. It is a restrictive type of surgery, and the patient after surgery will be able to eat small amounts of food. After the gastric sleeve, the hormone ghrelin decreases, called the appetite hormone. Another hormones such as GLP-1 increase. The main advantage are is a procedure quick and safe, performed by expert surgeons. It helps improve diseases related to obesity. There are no changes in the anatomy of the intestine, and the recovery time is really fast. The most important disadvantage in this procedure is that you can develop acid reflux after surgery. Approximately 11% of patients can be developed acid reflux. Weight loss with this surgery is 72%, maybe more, maybe less. It depends the follow, the diet after surgery. The average duration of this surgery is 1 hour. Hospital stay is 2 nights, and recovery, it depends your job, but average 1 to 3 weeks. Next, please. The gastric sleeve is an irreversible surgery. We eliminate 80% of your stomach, and the portion of the stomach called of the gastric fundus is eliminated. In this part of the stomach, 90% of the ghrelin, the appetite hormone, is produced. This will help the patient feel less hungry. After the gastric sleeve, the stomach capacity decreases to less than 5 ounces. The normal capacity is 50 to 60 ounces. It depends the patient. In this case, the single incision gastric sleeve is performed through a single incision through the belly button. The main advantage of this surgery is a specific aesthetic. This surgery has the same results as a conventional gastric sleeve. The stomach removed is the same, 80%. Candidate patient must have a BMI less than 40 is the preferable. The duration of this surgery is a little more in comparison with the gastric sleeve, conventional gastric sleeve. Hospitalization for 2 nights is the same, and recovery is the same, 1 to 3 weeks. Next, please. The endoscopic gastric sleeve, it is an option for patients had high surgical risk or for patients who have a low BMI. Weight loss with this procedure is less than 40% of excess weight. Is less effective in comparison with the conventional gastric sleeve or single incision. The duration is a little less in comparison with the gastric sleeve, 30 minutes, maybe more, 1 hour. You need only 1 night in the hospital, and recovery 1 week is enough. It's very important tell you this is different option if you want lose weight, but it's more effective the laparoscopic gastric sleeve. Next, please. Gastric bypass RNY. During this surgery, a small pouch is created at the top of your stomach and connected directly to the small intestine, bypassing a portion of the stomach and intestine. This reduces the amount of food that can be consumed and absorbed. In this surgery, it's very important to mention GLP-1, a hormone that helps control diabetes, is increased. It is the gold standard for treating morbid obesity, significantly improves diabetes and high blood pressure in up to 80% of the patients. It is the best option for patients with acid reflux. The main disadvantages are two. The patient may develop dumping syndrome and may have an increased risk of gastric ulcer, both caused by the direct connection of the stomach with another portion of the intestine. The duration of this surgery is average 2 hours. You require 3 nights of hospitalizations, and recovery is a little more in comparison with the sleep. In this case, 2 to 4 weeks. It depends your job. Next one, please. What surgery is best for you? In this image, we can summarize advantages of both surgeries. Each patient must be evaluated to know which is the best option. For example, a patient with severe acid reflux disease, the best option is gastric bypass. But if you have a little acid reflux, it's possible to perform gastric sleeve too. It depends if a light or severe acid reflux. The BMI is relative. For example, if you have BMI 30, 35, 40, I can do the gastric sleeve, but I can do too the gastric bypass. It's very similar, the parameters. Next, please. Mini gastric bypass. This is my favorite surgery because it's very effective. It is a surgical procedure that involves creating a small gastric pouch and attaching attaching a part of the small intestine to this pouch. Unlike traditional gastric bypass, only one anastomosis is performed. This is a difference. Weight loss with this surgery is approximately 76%, but you can lose more weight. It is an excellent surgery that effectively controls for diabetes and high blood pressure. This is a really good option. The main disadvantage is that patients may develop bile reflux. This is a principal disadvantage, the main disadvantage, sorry. It is a really effective surgery. The duration of surgery is approximately 1.5 hours, 2 hours. It's very similar to gastric bypass RNY. And the stay in the hospital is 3 nights. Recovery is similar to gastric bypass, 2 to 4 weeks. It depends your work, your job. Next, please. What surgery is best for you? Here we have a comparison between both surgeries, gastric bypass or mini gastric bypass. The main advantage of RNY gastric bypass is minimal risk of developing acid reflux after surgery, but increased risk of gastric ulcers because in this type of surgery, I will do to anastomosis. It's most common the gastric ulcers. Both surgeries have similar results in terms of weight loss and improvement disease such as diabetes, apnea, or high blood pressure. Next one, please. You have other options. Duodenal switch is a really good option too, but is less common performed because this procedure have more a little more disadvantage about the malnutrition. It is a malabsorptive surgery, hypoabsorptive surgery now, very effective. It's a complex procedure, but this procedure have good long-term results. Patients lose up to 80% of excess weight in the first year after surgery. Control of diabetes in more than 90% of patients in the first years after surgery. The main disadvantage is increased risk of malnutrition. The duration of this surgery is 2.5 hours or 3 hours is the average. 3 nights of hospitalization and recovery is a little more, 3 to 4 weeks. Next one, please. It depends on the type of job you have or recommendation for returning to work. For example, if you work in the office, is enough 1 to 2 weeks. Obviously, it depends the procedure, but in average is 2 weeks. If you work with light physical activity or mild physical activity, is necessary 2 to 3 weeks. Fast-paced, minimum 2 weeks to 4 weeks in case the bypass or duodenal switch. And hard work, I recommend you minimum 4 weeks. Next, please. We are a bariatric surgery team with more than 10 years of experience that offers a high level of expertise in the surgical treatment of obesity. With a decade of practice, the team has accumulated in-depth knowledge and skill in bariatric surgeries, including gastric sleeve, gastric bypass, and mini gastric bypass. Our experience allows us to provide a personalized approach for each patient, maximizing positive results and minimizing risk. Additionally, we are familiar with the latest advances in surgical techniques and postoperative care protocols, ensuring the best possible care for those seeking surgical treatment for obesity. Finally, it's very important to remind you that after bariatric surgery, supplementation is really necessary. MBC offers different supplements, including emerged bariatric vitamins, which are essential for adequate recovery. I recommend you totally this type of bariatric vitamins. It's very, very complete. Next one. I recommendation to do the last pandemic, COVID pandemic, wear mask, maintain your social distance. Vaccination is really optional, but I recommend you to prefer the vaccine for COVID 19 and test previous your travel is very necessary. Thank you.
Great. Thank you so much for taking time and explaining all these. Of course, we don't have a lot of time. We're trying to get uh, this done as soon as possible with enough information. Um, Thank you, Dr. Ceja. Um, I'm just going to take over and continue to covering several of these other um, slides, and one of them is about financing. Financing, if you need to basically get a loan, there are options out there. We work with several of the e-financing, UMC, United Medical, and Medicard for, of course, for Canadians. But there are other options. Your bank, your credit union that you have a relationship, or Bank of America. Those are all can be great assets for you to get a loan. And you can also look at other places like SoFi and Lending Club. But one thing I want to recommend is for you not to um, apply to too many places at one time, maybe one or two, because the minute you apply, your credit score gets hit, and then it will be harder and harder to get a loan. Another point that I need to really emphasize here is what we call MTI, medical tourism complication coverage. And we offer this package through Global Protective Services Solutions. And this we offer at $149. $149 would cover all these possible complications and um, basically travel interruption. I really think that everyone should look into getting that. And again, someone asked, how do I get that? It's very simple. We send you a link, you sign up, you pay, and you're done. And it will be in your file. And hopefully you won't need it, but if you need it, it's there. So again, seriously consider that. Now we are at the point that we can start answering the questions that has been put up in our FAQ screen. Okay, so I'm going to start going through them, and the ones that are medical, travel related, I would answer. The ones that is medically necessary, we would have Dr. Ceja answer. Um, So the question is, the first one that I see, is it true that if one gets revision surgery, that person may not lose weight? Dr. Seha, you want to answer that?
Yes. If the patient have a bariatric revision uh, pre- previous, yes, I can do other revision. It depends the patient, and the patient can lose weight more after the revision. Yes, but it's possible.
So basically, um, depends on what type of revision you get, of course, right? So there are always it's not as good as the first time. Of course, like we see maybe 5% of patients, let's say gastric sleeve patients, that they regain some of the weight they lost and over time. And usually those that they receive mini bypass from sleeve reversion, they do really well. I mean, but then again, if you're a bypass patient and you get a revision, that may not put you back to your ideal weight. So, so it's true in some cases, but you have to be aware that revision surgeries are always harder and may not do as well as the first time around. Um, through schedulers. Okay, so we covered that. Um, when we're done with our presentation, we usually post this on YouTube, and you can ask your coordinator or office to send you a link so you can watch it again if you need to. Okay, about the opening of the new Hospital Azar. Um, Again, we've been working on this project for a long time. Almost everything is ready inside, but there are some paperwork that we still need to put through, and um, you know, sometimes um, the paperwork doesn't move as fast as we hope. So I can't promise like, okay, well, in March or April we're gonna open, but hopefully soon. Let's say May, but we are, believe me, we are more eager to start the hospital. Um, okay, let's listen to this one. I had a VSG procedure almost. I gotta get some of this thing. Yeah, it keeps jumping up and down. Um, where did it go? I had a VSG procedure almost exactly 2 years ago. I've already been approved with Dr. Rodriguez of VSG to do dental switch. Um, so, okay. So this one I can answer, and I will have Dr. Ceja also answer. So this person is asking that that is approved for a revision from a sleeve to do a dental switch in our center, and another center approved them for a sleeve to bypass. This is exactly why I was trying to explain why MBC. Not every center can do a duodenal switch. So what they do is they say, okay, we'll just give you a bypass. Another thing they do, for example, is let's say your BMI is 55 Not every surgeon can do a BMI of 55 bypass. And they may either tell you you don't need bypass or tell you, okay, we'll approve you for bypass, but when you get down there, they convince you to get sleeve. We don't have this type of operation and we don't work like this. And that's why you want to go with MBC. That's exactly why you want to go with MBC. Aside from all the other points that I brought up, is you will get the best option that is good for you, because we're not limited to what we can offer. We're not going to sell you a jacket that is not going to be fitting you because we only have medium and you need a large, or you need a large, or you need the medium, we only have small. Say, okay, well, you don't have that type of jacket, but we can fit you this one. So this is really important. We see this day to day. Of course, some patients we catch and we try to explain why is it that they need to come with us. But some patients, they just take it as it is. And I'm not saying that bypass is better for you or DS. I'm not a doctor, I'm not a surgeon, but I'm just saying as a general observation that we see that they are giving patients the surgery types that they can only provide because they can't do other things, right? So if you look at the spectrum of what we can offer, we can offer we could do revisional procedures, force you to get it as something else that we can only offer. I mean, Dr. Ceja can also explain more.
If you have a gastric acid and you want a revision, I it's necessary no fears your BMI. And if you have acid reflux, don't have acid reflux. If you have acid reflux after gastric acid, my recommendation is better gastric bypass. But if you don't have acid reflux, both procedure can be performed. It depends to your BMI. If your BMI is low, the duodenal for me is really aggressive. I prefer a to bypass or bigas to bypass. But if your BMI is average 40 after gastric sleeve, I recommend you duodenal switch is a good option too.
Okay, um, so is it safe to have gastric sleeve surgery if you plan on getting pregnant in the next 1 to 2 years?
Yes, is really sure, secure safety for the patient who want after gastric sleeve pregnant. But my recommendation is wait at least 1 year after surgery because it's the time when the patient can lose more weight. 1 year after gastric sleeve is safety.
Okay, so they're asking about the anesthesiologist. You know how I mentioned we have 6 team of surgeons. So all I can tell you is, so each team of surgeons have their own surgical team and specialists. So, and most of the anesthesiologists that I know in different teams have years of experience, and some of them are even cardio anesthesiologists. So there are so much expertise in each team. And I'll let Dr. Ceja explain, about his anesthesiologist.
Yes, my anesthesiology is prepared in area. Um, we have a lot of instruments necessary for the safety of patient during the surgery. No problem. Really prepared anesthesiologist.
Um, so there are some questions about flying back home. Um, they're asking, when is it okay to fly back home? If I have a 5-hour flight to go back home, is that okay? In general, yes. There are some recommendations like wearing compression socks on the way back and be active. Don't sit down for 5 hours straight. Try to get up and walk around, and just every hour or so, just move around. Another option, if you are worried, you can again stay one more extra night. You can stay on the San Diego side, and just like I mentioned, use Hampton Inn to stay one more night and then fly back home. So yeah, should we be vaccinated for measles too? Um, they're asking if they should be vaccinated. That has nothing to do with the surgery, right? So do you require? No, yeah, we don't require that. What the test is also EKG. They're asking how much weight do you lose on Orbera? Um, I was going to mention something about this expected weight loss, okay, in general, and then I'll let Dr. Seha talk about gastric balloon. You remember that pyramid? There is no, like, everyone has a different metabolic setup. Everyone has a different genetics and lifestyle. And I have seen patients that got lost quite a bit with even gastric balloon. Doesn't work for everybody, you know, because it's only temporary. We also have Orbera, and we have um, SPATS. SPATS is the 12 months, and it's more permanent. But still, after the 12 months, you have to be able to keep up that routine. So, and then same thing with sleeve, a bypass, duodenal switch. Okay, in the uh, in the papers and books and publications, they always say, "Oh, you lose 65% of your excess weight." There is no limit. We see patients over and over that they totally lose all the extra weight with sleeve, bypass, DS. Of course, DS and bypass are more aggressive, but we still see them lose that weight and keep it off. So there is no limit of, we have patients that weigh 400 pounds and they lost 200 pounds. So with sleep. So we can't tell, oh, well, this is just 65% or 45% or 60%. This is a great tool. You just have to use it. Now, sleeve is a more permanent than a balloon. But you ask me, can I lose weight with the balloon? I'm going to let Dr. Seha also talk about this. But from our experience, you could lose it. It just depends on your discipline, depends on your lifestyle, depends on if you need a jump start. We go through some events in our lives. We lose somebody or something happens to us. We go through separating from spouse or things like that that may trigger that weight gain. And yes, you can always bring yourself back to your normal weight. And if you need a jump start, gastric balloon is a great tool. But then again, if you want a more permanent, yes, you need to look at other options. I'll let Dr. Ceja also talk about this.
Yes, definitely the gastric balloon or Vera is not the most effective procedure for weight loss. Is His effectiveness is very low, approximately 20 to 13% of excess weight. I don't recommend you. I recommend the gastric sleeve is better in comparison with the balloon or other endoscopic procedures, because this of procedures, the gastric balloon is not definitive, and they remove the balloon, it's very possible you regain more weight. And definitely, I don't recommend you the gastric balloon. It's more effective than surgery.
Okay, so thank you. And then I saw a bunch of questions about companion. Let's cover companion. So after COVID, we still kept the same protocol, which means we keep the patients in the hospital and companion stays in the hotel. They do have visitation. Last I know, it's 2 hour uh, visitation, but used to be 1 hour. So that's the last I know. And so they take you there, you visit your patient, and you come back to the house, to the hotel. Um, so Dr. Sehel mentioned about COVID. Yes, it would be a great idea for you to test for COVID before your departure to come from your home to our center for yourself and your companion. It's just a safe thing to do. And but we don't require it, but that's a good thing to do. Um, as I said, yeah. Um, oh, where is it? Okay, so let's talk about this driving situation. Okay, so in general, most patients fly to San Diego International Airport, like I said, and then the driver picks him up and take him over the border to our facilities, to our hotel, to our hospital. If you drive, some people like to drive all the way to our centers. That's fine. If you're comfortable driving to Tijuana and do that, there's no problem. All this is communicated when we book you, and we get all that information, put them in your file. Everyone knows, from people here to Mexico, the drivers, everybody is on the same system. Now, if you drive and you want to park, yes, you can park your car in the San Diego International Airport and then take the shuttle and go to the pickup spot in the terminal and get picked up. So that's another option. You can park your car, whether you drive to San Diego International Airport, you fly, we'll pick you up from there. Um, Okay, so how long after a hysterectomy should one wait for this bariatric procedure, Dr. Ceja?
You need wait at least 3 weeks, 3 months after hysterectomy. You need a recovery good for the next surgery. At least 3 months.
I saw one for PCOS, which was interesting. I just lost it. Maybe is it safe to get pregnant after gastric sleeve? I think we covered that, but you can answer it. So one thing that it's interesting about getting pregnant is you get after the procedure, you are more prone to get pregnant, and you may want to wait at least 1.5 years. So it's very important to be careful not to get pregnant for 1.5 years, and maybe because before of all the issues with being overweight, you wouldn't get pregnant easily, but now you are, you know more is more chance of getting pregnant after that. So but you have to be careful not to get pregnant for 1.5 years, but after that you're fine. Okay, so okay, talk about excess skin. So when you have rapid weight loss, sometimes depends on your genes, your skin tightness, type of skin you have, and how fast you lose weight and your age and all that, you may get lose skin. Not everyone gets it, but a lot of people do. Yet you may remove it. And we do offer that. We have a whole department which we call Mexico Cosmetic Center. MexicoCosmeticCenter.com, that's what they do, is they work with board certified plastic surgeons that they do all the mummy makeover, facelift, and all that stuff. Okay, um, so I'm just gonna type here. So what you do is you fill out a health questionnaire with MexicoCosmeticsCenter.com, and they get back to you, and then you send pictures, all that stuff, and they tell you what's the best procedure for you. It says, what happened if I gain more weight before my surgery, so my BMI is higher than initially was?
Mm, It's necessary the patient do well the pre-op diet because we need the liver uh, decrease his size, and and if you regain pounds before surgery, mm, no problem, but it's better if you lose weight before surgery, but no problem.
Okay, they're asking for PCOS. What's the best type of bariatric surgery? Someone with low metabolism.
If the patient have PCOS, the bariatric surgery better is a gastric sleeve or gastric bypass. 100% of patients have PCOS can be improved this process. And the best procedure is a surgical, every surgical procedure, gastric sleeve, mini gastric bypass, is not, I don't have a specific procedure for this disease, but all procedures function in this type of disease.
So they're saying, how bad is the gas pain after the surgery?
The pain after surgery for the gut is very tolerable. It's not bad. Uh, we can administer medicine for this type of pain. No, it's not really bad.
So this question actually is asked a lot of time. Is they're asking if I had a sleeve before, is it bypass better for me for revision or mini bypass?
Both procedures are good option. It depends specifically the acid reflux. If the patient have acid reflux, it's better gastric bypass are required. If the patient don't have acid reflux, both procedures can be performed.
So John is asking if I have a BMI of 64.3, what surgery do you recommend for me?
Uh, when patient have a high BMI, I recommend uh, gastric sleeve as a first option. But if the patient uh, want other type of surgery, I need to check uh, the questionnaire health for evaluate the specific his case.
Um, been asking about so skin removal details or that about passport. Okay, so we highly recommend that you come with a passport, either a passport book or a passport card, because it's a border, means the land crossing, so you can use a passport card as well. But either way, it's easier, less of a chance to get pulled over. I mean, most of the time, you may not run into problem, but sometimes you do, and that basically delays you crossing and getting to your flight on time. So it's better not to take chances. Oh, talking about hemoglobin and being anemia and having low iron. This, especially for the patients who are coming back for revision, we recommend you do a blood test, because if your hemoglobin is down, you don't come down there and now we have to cure it. So, and then you can start taking whatever to make it go back to normal. So it's very important to check your blood before you come. Again, we do the blood test down there, but um, but we we hoping everything is normal. But if you ahead of time, like something is off, you take care of it before you come. Yeah, so we do recommend a blood test. Oh, they're asking, can I stop losing weight when I reached my desired weight? So is it possible to just get to your goal weight and stop losing weight after that?
Yes, you can stop, lose weight when you achieve your better weight. But it's necessary contact the nutritionist for a specific diet when you maintain your weight, your ideal uh, weight. But only contact your nutritionist.
I need to just make some comment here. This is a tool that you acquire, and you can work with your tool. You can always use your tool to lose more weight or not. And, like for example, gastric sleeve is a smart tool and you can adjust. So there is no limit of what you can do with it. About companion, usually people come alone. Now, if you think you need somebody to come with you, um, like we said, they stay in the hotel while you're in the hospital. They have visitation. Some people bring more than one person. Yes, there are extra charges, but you can bring extra people. For those of us on extended release insulin, how and who helps us adapt dosing once we return home?
Is for me the ask the question, please.
So they're saying if we are on the extended release insulin, they mentioned the name of the medication too. What happens when they go back home after the surgery? Because now everything is changed.
Yes, is the diet after surgery is very different before surgery, and it's necessary this type of patients come back with his medical first uh, primary medical for uh, indicate the specific doses of insulin, but in necessary come with her primary physician.
They're asking about revision of a gastric sleeve to gastric sleeve. That's a very touchy subject, and not every surgeon consider doing a re-sleeve. They only do re-sleeve if the sleeve wasn't done right to begin with. So there's so many factors. Again, the best to know is to submit you a health questionnaire and let the surgeon review it, and then we will say yes or no. I mean, the surgeon would decide. Okay. So they're asking about ESG again. They're saying if is it stapling the stomach with endoscopically? Well, they're not stapling, they're suturing it. They're basically creating that restriction by suturing it. Instead of going through your stomach, they go through your mouth endoscopically. But nothing gets removed. No part of your stomach gets removed. Um, okay, so let's see. Okay, so about the prices they're asking. Um, so our gastric sleeve package starts at $43.95, and something I forgot. I knew I forgot that. So um, so the gastric sleeve starts at $43.95. Some surgeons have a little higher price. based on the number of years they've been with us or whatever criteria that are different. But that's a starting point for all inclusive packages. Something that we are going to do is for a limited time, our deposit, it will be only $200. So that's a very easy way to book yourself. Either yourself, you can book yourself or go through our coordination, but for a limited time, we reduce the deposit to 200. That I forgot to mention. And that's what the price difference was. Okay, so the process is like I said, you do the health questionnaire, you get approved. That could be quick. And then once you get approved, you can actually go online and book yourself. You pay the deposit, you book yourself, or you go through the coordinators that you assign to. You put the deposit again, whether it's Zelle or credit card or however you want to transfer that money, and you get on the calendar. And then once you get on the calendar, now you go arrange for your travel, come up with the rest of the money that is due 2 weeks prior to the surgery. So most people just show up with a cashier check 2 weeks prior, and we know that's how they're going to pay. We have a picture of it, and then they go down there, take the, the cashier check. So, what recommendation you make for if somebody have sleep apnea? What type of surgery do you think is best for sleep apnea?
All type of surgery is good for apnea. No excess specific surgery for this type of disease, but gastric sleeve, mini gastric bypass, or gastric bypass, the most common procedures, are adequate for this type of disease apnea.
Okay, great. Yeah, so our criteria to approve you for bariatric surgery is for laparoscopic procedures pretty much 29, 30 and above, and your age about 17 to like 40, 72, more or less. And of course, every individual is different. Um, for endoscopic procedures can go down all the way to 27 BMI, but sleeve and bypass, all those, well, sleeve, I mean, he's about 30 and above. They're asking about, can the stomach stretch after gastric sleeve?
Mm, not really. Can be accommodation that depends. Como, can be can the stomach no ground, no, it's possible because I could the a lot of stomach during the surgery, but it's not possible ground the stomach.
Yeah, if you're in Los Angeles, you can pretty much drive back home, no problem. Again, when you're driving back home, same thing I mentioned for flying, just don't sit still for a long time. Just get up every hour, walk around. have the compression socks. We have about, well, more or less over 50 more um, questions to answer, and we almost going to hit 2 hours. So, so most of the surgeons do use drain after surgery, and some of the surgeons, depends on how clean is the surgery, they may choose not to put a drain, but most of the time you get the drain. And but then again, depends on. So let me just check something here real quick. Okay, so okay, I think we are going to um, do our. Let me see if any of the presentation are still left. Yeah, we have some before after pictures to quickly show you. We have tons of these before after pictures on our Facebook groups that they share. Okay, so are we pretty much at the end that, okay, so if you didn't get your question answered, I'm so sorry. I mean, we only have so much time to talk. You can always reach back out to us, to our office, through your coordinator. Somehow you can ask us that question again, and we would definitely make sure you get your question answered. Um, I'm going to announce the winner, and let me check something here real quick. So, okay, the winner of our this time webinar is Amanda Abels. Amanda Abels, I'm going to let you talk, Amanda, and tell us more about yourself and how you heard about us. Are you ready to go get the surgery done or not? Amanda, do you hear me?
Yes, can you hear me?
Yes. Hi, Amanda. How are you?
Good, thank you.
Great, great. So tell us more about yourself. Where do you live and stuff like
I
that?
live in the Houston area, and I
Okay.
I'm a single mom, kid, 21-year-old, and sick, and I've been dealing with issues all the out, up and down, up and down. So I'm in my 40s. I think it's to get the weight off once.
Okay, well, great. Thank you so much for attending our webinar. Congratulations again. We'll see you down there with Dr. Ceja. Our coordinator is going to reach out to you, so get you on the calendar. Yes, thank you so much for everyone else. Dr. Ceja, appreciate you coming online with me, and we'll see you next time. Okay, thank you so much. Goodbye.
Thank you.